Great. Good afternoon, everyone. Thank you so much for having me participate in your meeting today. My name is Alita Ostapkovich. I'm an emergency management coordinator for Washington County, and for the past 5 months, I've been filling the role of the EOC liaison officer in our Emergency Operations Center. So today I'm going to talk to you about COVID-19 and the reopening of Oregon. What I'm going to cover today is the current status of our county, what businesses are required to do under the governor's guidance, about COVID enforcement in the county, best practices for the general public and customers, what to expect with contact tracing, and then I'll open up to a question and answers. Just a disclaimer that I put on every presentation I do, information is current as of today, 7/29. The situation evolves really rapidly and information changes all the time. So what you hear right now might be different tomorrow, might be different next week. So just remember that as we go along. And so to start off, in Washington County, we have 2,583 cases and 22 deaths. Last week, the governor announced that there are no indoor social gatherings larger than 10 people. And she also announced that face coverings are now required for anyone 5 years and older. So prior to this announcement, it was recommended for children ages 5 through 12 to wear face coverings. That is now required. She has created a new mask requirement website, which I have a link here to, and I'll send Bryce the presentation so everybody has this afterwards. You can go there and learn more about her face covering requirement, where it's necessary, and information like that. There's signs as well. One of the things I like to put on my current status slides is how we as a region and as a county are doing with the different metrics that the state looks at. So they update their metrics every Thursday. So unfortunately, this information I have is about 7 days old. It could be totally different tomorrow when it gets updated. But as of last week, we as a county were not doing great. Yeah, as you can see from the picture, we are not meeting 5 out of the 6 criteria that the state looks for. And then together as a region with Clackamas and Multnomah, we are not meeting 4 out of those 6. So actually, as I'm looking at it now, we should have 4 out of the 6 correct. They put an X next to the very last one, but let me run through these. So percent of emergency department visits, we've got that pretty low. We are seeing, unfortunately, an upward trend in the percent of positive cases over the last 7 days. We're also seeing a pretty high percent increase in new cases, about 30% new cases in the last 7 days than the previous 7 days. We have a pretty high amount of people that we aren't able to trace to a known source. So that's about 38% of individuals who test positive. We can't trace them back to somebody who is also positive. We're seeing an upward trend in hospitalization. And then we are able to follow up with 100% of our cases within 24 hours. So in terms of what businesses have to do right now for reopening to make sure that everyone is safe coming into their stores, all employees must wear face coverings. They must prohibit any workers who are showing COVID symptoms from working or entering the premises. So making sure that we keep the virus out of places that most people are. So by keeping them home, even if it's something as simple as a headache or a cough. I'm actually at home right now because I have a headache, which is one of the symptoms of COVID. So I'm keeping myself out of the office so I don't possibly infect anyone if I am asymptomatic or have the virus. Businesses need to close water fountains unless they are contactless. So that's really reducing one of those touch points that could get really germy that a lot of people might touch and others might forget to clean often. They need to post signs or posters about the symptoms of COVID, why we social distance, and then the need for face coverings. So putting those around the store at areas where people are going to see them and be able to read them, just so everyone has the information available to them about coronavirus and the best ways to ensure the spread is limited. So there's really extensive hand washing and cleaning procedures as well. These businesses, everybody has to clean high touch surfaces frequently. varies depending on the business that you go into, and sometimes even the time of day for that business. So it's up to the business owners and their employees to identify what is a high touch surface. There are common ones like doorknobs and counters, but depending on what type of business you have, there are other things, like some might have menus that they need to clean, others might have credit card machines they need to clean. And then in terms of how often you do it, it really depends on how often that surface is getting touched. So if you're in a restaurant and maybe you have a really slow lunch period from 11 to 2, you might only clean once an hour. But if you're having a really fast or busy dinner period from 5 to 8, you might be cleaning every half an hour, every 15 minutes, depending on how many people are touching the surface in that area. All businesses need to keep 6 feet of distance between different parties and between employees. So if you have tables set up, they have to be 6 feet apart from each other. If you own like a party place and you've got different bowling alley lanes, they have to be 6 feet apart from each other. And then making sure that your employees also stay 6 feet apart from each other, because even wearing a face covering, it might only stop 90% or so of the germs coming out of your mouth. So by keeping that 6 feet, anything that is still coming out of your mouth can't make it to another person. And they're also recommending that you limit the amount of employees who interact with a certain group. So normally if you go to a restaurant, you might get seated by a hostess, your order might be taken by a waiter, and then your dishes are taken away by a bus person. Now they're trying to limit that to only one person being interacted with, because that limits the amount of people that could possibly be getting the virus or sharing the virus to different parties. All parties need to be 10 individuals or fewer, and you're not allowed to combine parties. So say you have a table that has seating for 6 people, but only 2 people sit down. You can't have another group come in and use 2 more of those seats. So making sure that we're not commingling people who don't already live or expose themselves to each other. Businesses need to prohibit congregating in areas throughout the facility. So this could be weight rooms, it could be bathrooms, the parking lots, maybe nooks and crannies in a retail store that are really close together because of the shelves. So different areas depending on the business that you're going to, reducing anywhere that a lot of people could get into close contact with. Businesses are also encouraged to require reservations or advance tickets, or maybe require appointments. So depending on the business, this is either a requirement or an encouragement. So if you know you want to go to the hair salon or the nail salon, then you'll need to do an appointment. But if you want to go to the movie theater, they might just request that you do advance ticket orders. And then some businesses are required to collect your contact information. So this is for contact tracing purposes. It's just your name, your phone number, maybe the times that you arrived and where you were. So in the office building that I work in, we have our visitors sign in what time they were here and who they were going to see. So that way, if public health needs those records, they can call those individuals who were in our building from 10 to 1 one day when we knew somebody was sick in that area, and alert them that they should be quarantining. So most of the time, the businesses who are required to collect this contact information are businesses who have those waiting areas or those time periods that people are just standing around waiting to get a service or start their reservation. So retail stores, grocery stores, things like that aren't required, because you're in and out, you're moving so quickly. It's not really an area where people congregate for long periods of time. So at the county, we have a COVID enforcement team. And this is for anyone who is noticing or experiencing a business not following those recommendations or requirements. You can report it to our enforcement branch in public health. They have a phone number and an email. And so what they do is they take that complaint. So say you went into the Fred Meyer and you noticed that the employees aren't wearing face coverings, you can report that to enforcement. What enforcement does first is track down to make sure that that is valid. Before we started reopening, we were getting a lot of calls from people saying like, oh, we see that this person's working out in the Planet Fitness or in the gym, but they're not supposed to be open. And then when enforcement followed up. It turned out it was a fitness instructor recording a video for his students. So they want to make sure that there is validity behind the complaint before they take an education-focused stance or action. And so this was an escalating complaint system. Really, enforcement is there just to make sure that all of the businesses are educated on what they're supposed to be doing, have the resources that they need to do that, and can follow the rules that way. It's less of a citation and bring a law enforcement in and trying to get people in trouble. We're just trying to keep everybody safe and making sure that everyone in the community is doing their part. So in terms of the escalating complaint system, first what happens is a phone call. So if you get one complaint on your business, you'll get a phone call from enforcement. They'll talk you through the complaint that was there, where the resources you can find are, listen to your side of it, and let you know some ways that you can improve your social distancing or safety impacts. And then after that, so say you get one and then 7 days go by and somebody else does a complaint on your same business. Now you get escalated to getting a letter in the mail with a packet that you have to fill out and more information on resources. And then say 7 more days go by and you get yet another complaint, then it escalates to a site visit. So somebody in enforcement, there also are environmental health specialists, so they already have a background in checking facilities for safety. So they'll come out and do a site visit, a walkthrough to see what's going on and how they can help you. I don't know if you noticed, every time I mentioned like, oh, if 7 days go by, a couple of days go by, they leave that buffer in there so that a business isn't getting 3 calls in a day and then they get a site visit. They want to allow the business enough time to implement what they've been educated on. So for best practices for the public, number 1 is wear your face covering, right? It's mandatory in all indoor public spaces, and it's also mandatory outdoors when 6 feet cannot be maintained. So this would include if you were inside at a gym working out, you need to wear a face covering, and that's really because you want to put a barrier between what is coming out of your mouth and the people around you, because you don't know what type of germs are in your spit, in your cough, anything like that. So by putting a physical barrier there and stopping it, it doesn't matter what germs there are. Nobody's going to get impacted by them. You should also know what to expect from the businesses that you're going to. So some businesses have reduced their hours. They used to be open till 9, but now they're only open till 6. They might also have special hours for different populations. Every Tuesday and Thursdays, it's senior hours from 9 a.m. to 10 a.m. So you might not be able to go if that's not part of your population, or that would be the best time for you to shop so that you reduce your risk. You also know what businesses are doing in terms of reusable bags. So some businesses are allowing you to use reusable bags, but you have to bag your items yourself. Some people say you can't bring them in at all. You have to use the paper or the plastic that is there. So different things like that. And then also know what to expect in terms of returns and dressing rooms. So for returns, some businesses might have a specific period or window when something can be returned. They might be only allowing some returns and not other items being returned. And for dressing rooms, they might be keeping those closed. You might have to wait a little bit longer. There might be other safety things that they have implemented in those areas. Another best practice is to wash your hands. So wash your hands, don't touch your face or mask, and stay 6 feet away from each other. All kind of go together, right? Because the way you get the virus is by getting germs into some part of a hole in your body, your mouth, your nose, your eyes, your ears. So if you don't touch your face, you're limiting the amount of contact you have to one of those holes that go into your body. If you wash your hands, you don't have any germs on you that could go into those holes, right? So it's a couple of different layers of stopping that virus from getting to you. And then if you're staying 6 feet away from each other, you're limiting the possibility that somebody's germs could get into you by way of air or spit. So in terms of contact tracing, let's cover kind of what to expect with contact tracing, since this is really the biggest aspect of the public health measures to reduce coronavirus spread in the community. So I'm going to walk you through kind of what happens with contact tracing and the whole process. When we say contact tracing, it's a much bigger system than the word makes it seem. So first what happens, we start at number one, somebody has no symptoms and they go out into the community and then they start showing symptoms and they test positive. So that positive test result gets sent to public health, and public health will then call the individual who tested positive and follow up with a case investigation. So this person is staying home because they're sick now, they're limiting their contact with other people, and now they're talking to public health about where they've gone in the last 14 days, who they have had close contact with. So in this case, close contact is anyone they've been within 6 feet of distance for more than 15 minutes with. So they try to provide public health with all of those names and contact information, because then public health will reach out to each of those individuals who could possibly be infected and ask them to quarantine and monitor their symptoms and check in daily if something changes. So while they're doing those active monitoring, which is the daily symptom check-in, we have our individual who is positive still isolating at home while they're sick, and then their symptoms start to resolve. They don't have a fever, 10 days pass since their symptoms, and they can go back to work or school or whatever they were doing before getting sick. But in the active monitor phase, say we have one of those close contacts who is quarantining because they were exposed, and then they start seeing symptoms. They have a headache, they have a cough. Well, then we start kind of all the way back at the beginning where they get re-registered into the public health database and walk through this whole system themselves. So they have a case investigation, and then we contact trace on their contacts. So that's kind of the whole system of what happens with public health. So the two places you might be talking about public health are if you test positive or if you came in close contact with somebody who did test positive. So in the second case, if you are getting talked to because you are a close contact, some information, you'll get a phone call from either our 503-846-8400 number, which is just our standard county line. Your caller ID might say Washington County, or it could say Washington County Public Health. So there are a couple of different options. We continue to onboard new staff, and they're given cell phones to do their work. So in some cases, they might have a caller ID that says Washington County already, but some of the newer staff might not have this yet. So all numbers start with 971-330 or 971-804. So a contact tracer is never going to ask you your social security number, your immigration status, or your credit card number, your bank account information, or your billing information. So that is too personal of information that contact tracers are going to ask for. If anybody starts asking you about this, then you hang up because you know they're not part of our system. Actually, one of the cool things we have here in public health is another phone number that if you get a call and it seems a little sketchy, you don't know if they're an actual contact tracer, you can call this other number and verify, and then you can continue talking to them about your personal information. So what do contact tracers ask? So they've asked where you have been and who you've had close contact with in the past couple of weeks. They'll ask about your health, your housing, and your employment status. So mostly it's the housing status is, are you able to isolate from anyone you're living with, or do you live alone? They help you come up with an alternate housing situation if you can't isolate in your house or if you're going to put other people at risk. In terms of employment, they ask if you are able to take the time off while you're sick, or if something is in place for you to have that buffer. They also can connect you with community-based organizations who can help with rent and utility assistance while you're sick, can help you get groceries delivered if you need it, if you don't have somebody who can bring you groceries for the time that you're sick. They'll ask if you have what you need to stay safe and recover, and if not, help you come up with a plan so you can do this safely. Washington County does have an isolation facility. We call it our respite shelter. So in the event that you aren't able to stay at home without putting other people at risk, you do have the option of going to the respite shelter for the time that you are sick. And so then just again, we don't ask for social security or credit card. We don't ask about your immigration status, and then we don't share your identity with the federal government. There's actually very little that a contact tracer or public health is going to share about you to somebody else or some other organization. Since most of what you give us is protected health information, we try to keep it really private. We even go so far as to make your employer sign a confidentiality agreement so that they can't, send out a blast email to all the employees that say like, Joe Smith just contracted coronavirus, trying to really keep everything secret because it is your private and personal information. So I like to put some online resources up. The Oregon Health Authority coronavirus page is great. It's a little difficult to navigate, but it's got tons and tons of resources. So you can go there to find out county status. That's our number of positive cases, number of deaths, and then number of cases that are negative. They put out a daily report and a weekly report. I think the weekly report is pretty interesting because it does break it down even farther into cases by zip code. They also report out any businesses who have 5 cases or more. So a lot of great information there, downloadable posters, information about reopening, multiple different languages. We have Governor Brown's coronavirus page. Also talks about reopening, has those downloadable posters, any of the guidance documents you need for the different businesses, or if you're looking for FAQs. And that side, I think, gets updated a little sooner than OHA does, but I tend to find that the translated versions go on OHA better or quicker. And then we have a Washington County coronavirus page. This has a ton of great information. So if you're looking for a testing site, we list it all there. Everything I talked about contact tracing is on there. If you have questions about workplace guidance, we have a page for that. We have an entire page that's in Spanish. So all of this information is in Spanish instead of relying on Google Translate to translate. So a lot of great information there if you're looking for any more information. Okay, and I end up talking very, very fast when I present, so it's time for questions. I'm gonna stop sharing my screen so that I can see everyone. Hey, does anyone have any questions?
Yeah, I have a question for you. I went to the veterinarians yesterday with my cat, and they do not allow us inside the building at all. Is that a rule that Washington County has come up with?
No, it's a recommendation. So in some places, you have to have your waiting room closed. So that would be your nail salons and hair salons. And most other places, that's how they have decided to keep people safe, right? Because we can't have people congregating in areas. So your veterinarian has decided to keep everybody out in their cars to close the wait room and not have people congregating there.
Well, and my point is they're not even allowing you to go in with the pet during the exam. So.
Yeah, and that's up to the business to decide. It's nothing that Washington County mandated or has a decision in. We don't have a part in that decision.
Okay.
With Washington County's continual rise in COVID cases, are there particular places that are showing this increase within the county? Are there any hot spots around?
Interesting question. Right off the bat, I don't know that I can get an answer for you. I know on a call today, I heard we don't have any businesses with outbreaks, so that's great. And it doesn't seem like any of the communities really are the hotspots. More, it's individuals who are getting it community spread.
What's the current status as far as gyms and swimming pools being open?
Well, swimming pools are not allowed because they're a phase 2 reopening, and we are only in phase 1. And then gyms are allowed to operate in phase one, and they have a huge guidance document that they have to follow in order to operate safely.
I have a couple questions. You mentioned bowling alleys, but as far as I know, bowling alleys aren't open in phase one yet.
True. Yep, they're
Okay.
open in phase two. I was just
Okay.
reaching for an example of where multiple parties might be gathering.
What about airlines? Are they, I understand that they're pretty full now.
Yeah, and we don't have anything at the county or the state level really that we can do about airlines. That's a federal regulation, and they're federal companies. So yeah, some of them I know, American and I think maybe Delta or United have decided not to leave that middle seat open. Others are leaving it open. I know I flew Alaska at the beginning of July and they had a HEPA filter. So unfortunately, that's not something we really can regulate or do anything about.
Oftentimes in the news, I will see long lines of people lined up for COVID testing. Do we have public sites available in Washington County? And are there long lines there?
Yeah, we have one at the Hillsborough Stadium. OHSU does free public testing, and I've heard that wait times can get up to 3 hours long. Yeah, we are lucky though in Washington County and have a lot of sites for testing. So if you go onto our county website and look at the testing sites, there's probably a dozen locations doing testing. Just OHSU does it free, and you don't need symptoms. Other places have the requirement that you have to take a survey and have symptoms or have a note from your doctor. So I think that's why OHSU's site is so long and has such a big wait time, because they don't have those requirements.
One of the things that I noticed was that there was a set of things for phase one, phase two, and phase three. That seems to be at the complete discretion of the governor, and it just keeps moving there's no way for a business to decide how they're going to function if the bar keeps changing on this. How can we operate in a civil society when the government decides what is right, what is wrong, and they don't keep to those regulations?
Yeah. Well, I mean, you have to understand, right, the coronavirus is new. We're still learning things about it. None of us have a crystal ball to say like, oh, well, if we make this decision, it's going to hold true for the next 6 months. The government makes decisions with the information that they have now to the best of their ability. And then when they change, it's not with light heart, it's what the science says will keep people safe. And if you've noticed, the governor, she does things incrementally. So recently she said in phase 2 counties, restaurants and bars need to close at 10 p.m. instead of midnight. Alternatives to that would be that they have to close down entirely, or they could only do outside seating and dining. So those create even bigger waves and ripples. So as new information comes out, she tries to come up with guidance that will keep people safe without completely rocking the boat. So unfortunately, it's because we're in an emergency situation and not much is known about coronavirus, or we keep learning new things, that the guidance changes.
Do you know what the turnaround time is on those free tests?
Ooh, not off the bat, but it's getting worse, I hear. We have about a 3-day wait period for a test result to come back. Some places in the country are experiencing 11-day lag times. So yeah, some places are a little faster than others, I think, but generally about 3 days.
It seems like with the contact tracing and people, and it seems like you might have an idea of how long it takes for symptoms to onset for people that do show symptoms. Is that something you have info on?
Yeah, so outward bounds would be 2 to 14 days, but the majority of people start showing symptoms 5 to 9 days after exposure.
How accurate are those tests?
Hmm?
How accurate are those tests?
I do not know. I'm not a medical individual to know that much.
Well, my wife's going in for surgery, and we have to both be tested at least 3 days
Hmm.
before.
Yeah, the same with my mom when she had her surgery. She had testing 2 days before.
Yeah.
Does anyone else have questions? All right. Thank you guys so much for letting me present. I hope that this was useful information and an enjoyable afternoon.
Thank you so much, Alita, for coming. I mean, there's just so many ongoing questions, and I think we had some good ones here, but I didn't even know that that was a resource that was out there.
Thanks.
So thank you.